What up, y'all? Beans, y'all. It is that time again. I'm Andrew Defy, a.k.a. the Gorilla Poet Laureate, a.k.a. the Hoodie God, a.k.a. Spitting Quarantino, a.k.a. I wear my sunglasses at night because my eyes are as sensitive as my heart is, y'all. And, I'm just hoping this finds you and yours both healthy and joyful on this Monday night. This is the Masked Up Community Health live stream, broadcasting live at 8:08 p.m. on Monday nights, bringing you health news from around the globe as it impacts California. Lots of things going on tonight. We have two special guests. We've got the founding director of the Center for Reducing Health Disparities at the UC Davis Health System, Dr. Sergio Aguilar-Gaxiola. Yeah. And we have also got psychiatrist and professional conspiracy debunker, Dr. Joseph Pierre, who is going to talk to us about separating COVID-19 fact from fiction, y'all. Man, feels good. Is it just me? Overall, it feels like things are starting to lighten up a little bit. I mean, I don't want to speak too soon. Some of y'all are out here throwing renegade parties like it's the 90s and ready to risk messing it up for all of us. But we are in the home stretch, y'all. I just want to encourage everyone to continue to stay masked up, stay washing your hands, and consider if the vaccine is right for you through unbiased research and scientific reasoning, which is what we bring you here every week on this show. And cheers to us, because this is episode 20 of this here show. Yeah. Bam, 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 bam. No, really, 20 episodes is big. I created Masked Up as a community resource so that my people in Sacramento would have a place to ask questions and be kept up to date on the COVID-19 pandemic, which is funny because some of y'all only know me from this broadcast, and you don't know that when I'm not hosting this show, I'm actually the Poet Laureate of Sacramento. I don't have some extensive medical background other than my own experiences, which actually involve a whole lot of medical trauma due to my own condition. So if you don't trust the healthcare system or you've had bad experiences, I get it. If you don't trust the pharmaceutical companies, I more than get it. This isn't that. For 20 episodes now, we've had the opportunity to learn the science together. I am not here to tell you what to do. I am here to explore and clarify with the professionals. And speaking of the professionals, thank you to our partners at Protect Us for connecting me with all of the incredible healthcare workers that I get to interview in the course of doing this show for the last 10 episodes. And to all of our broadcast partners that help us amplify the signal of this broadcast every week. The show would not be the same without you. All of that being said, let's do what we came to do. I thought you already knew. It's time for the weekly Rona update. Yo, so last week, the CDC released some new public health recommendations for vaccinated people. For the purpose of this story, fully vaccinated means 2 weeks or more have passed since you received your second dose in a 2-dose vaccine series, like the Pfizer or Moderna, or at least 2 weeks have passed since your single dose Johnson & Johnson. So 2 weeks after your last shot means you are fully vaxxed. And so what changes, y'all? People who are fully vaxxed can visit indoors with a small number of other fully vaccinated people without wearing a mask or physically distancing. Visit indoors with unvaccinated people from one other household without wearing masks or physical distancing unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. Refrain from quarantine and testing if they have been exposed to a person with COVID-19 and they do not have symptoms. But yo, the vaccination does not mean that the work is done, y'all. So people who are fully vaccinated should still continue to take steps to protect themselves and others by wearing a mask, staying at least 6 feet apart from others, and avoiding crowds and poorly ventilated spaces. These precautions should be taken whenever they are in public, gathering with unvaccinated people from more than one other household, visiting with an unvaccinated person who is at increased risk for severe COVID-19, or who lives with a person who's at increased risk. Avoid medium and large size in-person gatherings. Still, watch out for symptoms of COVID-19, especially if after contact with someone who is sick. If they have symptoms of COVID-19, they should get tested and stay home and away from others. So y'all, if you want more information, go to vaccinatelacounty.com, and it's just got some really good resources for you to use over there. So yeah, that's what changes if you go get vaccinated. Now we are going to get on to the latest health news. So the U.S. has a tendency to become an echo chamber. So we like to check in with news sources from around the globe as far as what is happening on the cutting edge. Today, we're going to take a trip to Singapore, where they are reporting on China's proposed vaccine passport. What's a vaccine passport, you ask? The terror of every COVID-19 conspiracy theorist. Vaccine passport is just what it sounds like. You have to show proof of receiving the COVID-19 vaccine in order to get out of the country. So let's check out what exactly they are talking about over here. And cue it up.
China has launched a so-called vaccine passport for travelers. Citizens can now display digital certificates via the social media platform WeChat as proof of their vaccination status and COVID-19 test results. China is the first country to roll this out on a large scale, but there are ethical concerns.
At the present time, the use of certification of vaccination as a requirement for travel is not advised because, quite simply, vaccination is just not available enough around the world and is not available certainly on an equitable basis.
Olivia Song joins us for more. Olivia, tell us how this vaccine passport would work.
Well, China is calling it an international travel health certificate, and I had a look at it for myself just now, although I had to enlist the help of a local Chinese colleague because this service is not available to foreigners like myself, but only made available to Chinese citizens. But it is relatively easy to access. All you have to do is to use the WeChat app on your mobile phone, and WeChat is very commonly used here in China on a daily basis. And all you have to do is to scan a QR code, which will lead you into a mini program. Now, once having entered this mini program, you would then be able to select whether you are entering China from overseas or you are leaving the country to generate this health certificate, which would then have your personal details as well as information like your nucleic acid test as well as your antibody test. In addition to that, it will also state whether or not you have been vaccinated and as well. Now, this certificate would be available digitally, or you could print it out, and there is an encrypted code on it that will allow authorities to verify your personal information. Now, this service, however, is only available, according to the Foreign Ministry, for outgoing travelers, those leaving China at the moment, though it is not certain. There have been no details on which countries China is speaking to at the moment that would recognize this certification. On Chinese social media site Weibo, there were many netizens who had cheered the move. There were some who said that this move is timely, especially as China is gearing up to host the Winter Olympics next year. Although there were others who said that perhaps this service would be more useful for incoming travelers because there aren't that many people leaving the country at the moment, given the situation, the COVID-19 situation around the world.
And Olivia, tell us of the ethical concerns.
Yeah, so this was a concern raised by the WHO, as we heard there earlier, saying that there are concerns about ethics because if this were to be made a requirement, vaccines are not available that easily, and this raises questions about equity. But then we hear China's foreign ministry talking about how even as the pandemic continues, the world economy needs to be restarted and that people-to-people exchanges must resume without delay. And the ministry has said that China stands ready to discuss with other countries how it can establish mechanisms that will allow both sides to recognize the health code information that's being provided on both sides and on the basis of accommodating each other's concerns. And we do know that this plan was first announced on Sunday by Chinese Foreign Minister Wang Yi. And he said that this move will facilitate the safe and orderly flow of people, and while protecting personal privacy, will also allow countries to mutually recognize this important COVID-19 information.
If you
That is what is going on. All right. So yeah, that is what is going on with the vaccine passport. China is not the only country proposing these vaccine passports. Now, this is a very interesting conversation for a number of reasons. The first of which is that most of these proposed vaccine passports are app-based, which also means they are inaccessible to any population without access to smartphones. Also, some countries, including the EU, are talking about only granting these passports to particular vaccines, so like only Moderna or Johnson & Johnson, but not Pfizer. In addition, countries are setting arbitrary passport expiration dates based on no real data. For example, China's vaccine passport expires 1 year after you were vaccinated, and you have to get a booster to renew your passport, but there's no evidence that immunity will go away after 1 year. It's completely arbitrary. Add this to a growing concern about data privacy, and experts are split on the idea of vaccine passports. The World Health Organization is against them. President Biden and other leaders are considering anyway. So COVID-19 can affect anyone, but for the Latinx community, the coronavirus pandemic is exposing health, social, and income inequities. Ms. Rona has also clearly shown disparities in disease rates, exposure, testing, and prevention. Here are 8 big ways that coronavirus is currently impacting the Latinx community. Coronavirus rates. Early reports from hotbed areas include NYC and Oregon show higher COVID-19 incidents and death rates among the Latinx community than their white counterparts. Testing and healthcare. People with health insurance get tested for COVID-19 more frequently than those who don't, even if tests are free. 19% of the Latinx fam are uninsured. Jobs on the front lines. Only 16.2% of the U.S. Latinx population can work from home. They are overrepresented in high-contact jobs including food, retail, hospitality, and health, with little to no paid leave. Social distancing. Essential workers are more likely to be exposed to coronavirus and less likely to be able to do social distancing. This means they risk exposure for a paycheck. Poverty. The Latinx fam represents 27.2% of the population in poverty. Coronavirus exacerbates the inequities in access to social support, housing, food, and more. Food insecurity. 16.2% of the Latinx community suffers food insecurity. This means families are unable to stock up on food or buy online during the pandemic. Housing and rent. 56.9% of the Latinx community are housing cost burdened, spending about 1/3 of their income on housing. Coronavirus has only worsened housing instability for everyone. And 8, no open space. People are walking and biking more during COVID-19. Trail use has risen something like 200%, but the Latinx community has less access to sidewalks and green open spaces for activity among social distancing. we wanted to dig a little bit deeper into how the Rona has impacted our Latinx family. So Netta got in touch with Dr. Sergio Aguilar-Gaxiola, the founding director of the Center for Reducing Health Disparities at the UC Davis Health System, to talk a little bit more about it.
The two most
Hey, how's it going, Doctor? How are you today?
I'm doing great. How about you?
I'm fantastic. I get to sit and talk with you and pick your brain. So, I mean, let's start off with the big questions here. Can you tell us a little bit about mental and physical health disparities in the Latinx community, and what are some of the root causes of these disparities?
Yes, sure. Well, in the Latino community, the two most, in my opinion, important disparities is access to care and utilization of services. You know, Latinos, both in terms of accessing care for health in general, and specifically also in mental health, they are known for decades to underutilize services. And the two main problems are that they don't have as much access to care, and also that they, once they get into the doors of service, that they utilize the services. And there are different reasons related to that. You know, one that we have been, well, actually, we use a mnemonic that help us remember some of the root causes, at least. We said that issues related to health and mental health in Latinos are related to the 5 A's. So it is accessibility, is appropriateness of services, is affordability of services, and is advocacy, and it is availability of services. So those are the 5 A's. So Latinos, like other populations, but for example, here in California, we comprise about 40% of the population, and about 50% of Latinos speak Spanish at home, for example. And therefore, the availability of services in Spanish provided by bilingual providers is of critical importance, because as it happens, for example, there are studies that show that up to 75% of Latinos that get into the doors of service don't return for a second time. And why are those reasons for them not returning? It has to do with culture and language primarily. There are other reasons, but those are the two very important ones. So, and this takes me to appropriateness of services, that if the services can be provided in the language, and they see that their culture is being considered. You know, there are cultural cues that are of critical importance. For example, you walk into an office and you don't see any signature, or you are not greeted, or no conversation, let's say in Spanish, or you know, the pictures don't relate in anything to you, it's unlikely that you are going to feel that's a welcoming environment. And if there is no, you know, small talk or chit-chatting, with the receptionist. That is also a signal that you may not be as welcome, so those are very important things. The other thing is affordability. We, for decades, Latinos tend to have the lowest rates of insurance, both medical insurance for health services and for mental health services. So just not having access to care because they are low in affording the services is a big issue. Finally, the other issue is, or two issues, is accessibility. That there are, a good proportion of the population, sometimes they don't have transportation, and going for services may take public transportation. I have known of cases that it takes them a couple of hours to get to the services are. And sometimes when they get a little bit late, then they are not seen anymore because they say your appointment was at 3 p.m. and it is 3:15. You missed the opportunity. Finally, the other one is advocacy. That navigating the health systems is pretty challenging sometimes because the paperwork that needs to be done, because the fear that they are not going to be understood because people in the office don't speak Spanish, for example, if the person is a Spanish speaker, that if they come with family members, I had used to give clinical services myself, and it was not uncommon for the mother or the father or one sibling to come with half of the family. So in the waiting room, there might be, sometimes 2 or 3 people, and sometimes receptionists are not as sensitive as they could possibly be, for these nuances, for example.
So we talk a lot about mental health on this show, and you are an internationally renowned expert on mental health in ethnic populations. You conducted the largest mental health study conducted in the United States on Mexican Americans. What made you interested in the research, and what were your findings?
Well, thank you for that reference. Actually, now it used to be the largest study ever done in the U.S. in people of Mexican origin, and it was funded, that study, in the middle of the 90s. It was funded by the National Institute on Mental Health. And now is the second largest because there is another study that was done nationwide with bigger numbers. But, it continues to be the largest, specifically on mental health, with seasonally employed migrant workers, for example. We have a comprehensive study that we were able to do. And we look at things like frequency of mental disorders, who was using services if they needed them, who was not using services, who started to use services and they stopped using services, and also what is called risk and protective factors. What are those factors that are associated with having certain mental disorders? For example, we know that depression is more common in women, substance abuse is more common in men, and so we also study studied risk and protective factors. That is very important because it gives us a sense of where to look at and what are the kind of things that can give us in clinical practice an idea of questions that we can ask and otherwise we wouldn't ask them. The findings that I can share is, and what we reported actually has continued to be reported after almost 30 years. And and that is that when it comes to people of Mexican origin here in the U.S., in particular of Mexican origin, is that the U.S. born tend to have higher rates of mental disorders, for example, substance abuse, anxiety, depression, than those who were born in Mexico. And those who have the lowest rates of mental disorders are precisely the seasonally employed migrant workers. However, an important finding for us was that there were tremendous differences on who is utilizing services. For example, the US-born 1 out of 3 who are in need of mental health services because they suffer from depression, anxiety, or suffer from substance abuse. And sometimes that, along with diabetes or hypertension, we call those comorbidities, the co-occurrence of mental disorders among themselves, but also with physical conditions. And what we reported, for example, that 1 out of 3 of the US-born were using any kind of service, and I can speak about that just for 1 minute after I tell you a little bit more. 1 out of 6 of those who were born in Mexico were using services, and less than 1 in 10 who were needing services of the seasonal and employed migrant workers. You know, this is 1 in less of 10. That's very, very low use of services. And you know, one of the great things that it was a great experience for me is that when we came up with those results, and there are other important findings, we had a chance to create a model to increase access to care to the low income, primarily rural populations that were way underutilizing the services. And you know, there are really good reasons why it is important to provide timely, appropriate services. One of them is that you know, Latinos are notable, for example, to go and seek services when they are falling apart. You know, they wait too long, and they go to the emergency services. And we know that the services that they can get in the emergency room are 10 times you know, more expensive than the services that they can receive in an outpatient you know, manner. And,
Right.
and also they tend not to be as effective. So there are economic reasons why it is important to provide services in a timely, comprehensive, you know, a cultural, linguistically sensitive manner.
And so, you know, you not only did the research, but you found a way to actually translate that science into policy change. Can you tell us a little bit more about that? Because that's like superhero stuff right there.
No, you are very kind. No, it is just to really put whatever research results we find into practice. It is the commitment to not just leave it as part of an interesting article that goes into the shelves and gathers dust, and no one, you know, remembers that. The challenge for all of us is to, as you well said, translate those findings, that information, into policy and into practice. And in our case, you know, we have worked with, for example, with legislators, with policymakers, with administrators to increase the opportunities to improve access to care and utilization of services. Right now, for example, we have been working for 5 years, a little over 5 years, in a county-wide system in Solano County, for example. They asked us to come in our center and help the county to improve access to care for Latinos, Filipinos, and LGBTQ populations. And they show us the data that there was underutilization of services by at least by Latinos and Filipinos. And they ask us, we want to work together along with our community partners to increase access to care and utilization of services. Fast forward 5 years, and I'm very happy to tell you that we have some really good positive results, which is possible when we come together, and we coordinate, and representatives from different sectors, from the county services, community services, but also representatives like, for example, churches, schools, social services, law enforcement, transportation. When we come together and figure out ways in which we can coordinate these efforts, that positive results can come about.
All right, so I have one last question, and it is the question that I ask everyone who comes on as a guest for this show, and that is, where are you finding your joy these days?
That's a great question, especially under this era of COVID. And I can tell you, I have no question responding to you. One of the silver linings of COVID for me has been getting closer to my family. I have, my wife and I have been married for almost 50 years. We have 4 kids, all of them adults, and we have 5 wonderful grandkids. And this has brought us together. Actually, we had been so much in touch with one another. And I'm actually moved to tell you that thankfully, my oldest son, his wife, and there are 2 kids, the smallest of the 5 grandchildren live here in West Sacramento. So we are right in the same vicinity. And now we are able to hug each other. My wife and I are vaccinated, fully vaccinated, and they also are taking themselves very, very careful. I mean, they are staying safe, and that allows us to come and get together. So one of my joys is just to be with family. I love music as well. I'm a music lover, all genres. I enjoy Celtic music. I love to read as well, Andrew. I can tell you that since I was a kid, reading captured my imagination. I could travel in my mind when I was a kid, and now, before COVID, I was traveling a lot because I do work with the World Health Organization and the Pan American Health Organization. And now I can tell you that I'm a part of this incredible initiative sponsored by WHO that we call the World Mental Health Survey Consortium. And I'm on the executive committee right from the beginning. We started on 2000. Now I'm coordinating all of the participants of Latin America and the Caribbean. And I travel a lot. But I can tell you, I don't miss travel. I love to stay put and to be in touch. I have been calling friends, childhood friends, that I haven't seen and haven't been in touch for over 50 years. And that's what I do on Sundays or Saturdays. I took my time to really be in touch. And it's just been wonderful to be able to do that.
Absolutely. And an inspiring an inspiring source of joy for all of us, that actual connection. So we really appreciate that. Thank you for coming by. Thank you for talking to us about all of these things and giving us these insights. And we're going to have you come back on to talk to us about 50 years and how you stay happily married for 50 years. That'll be our next visit.
I'll be happy to share some of the pointers.
Absolutely. Thank you so
my
much.
Pleasure, my genuine pleasure, Andrew. Thank you so much.
Absolutely. Oh, keep these producers on their toes here. Yes, it's time for It's Called Science. We talked a little bit last week about conspiracy theories and how people get sucked into them. All it takes is a morsel of truth, and people we care about can end up all the way down the rabbit hole. And usually there is at least a morsel of truth in these conspiracy theories, whether this is because the distrust in our institutions is valid or just because that's how patterns work scientifically. There is generally something factual amidst the fiction. This is partly due to something called the Ramsey theory.
If you line up the entire text of Moby Dick, which was published in 1851, into a giant rectangle, you may notice some peculiar patterns, like these words, which seem to predict the assassination of Martin Luther King, or these references to the 1997 death of Princess Di. So, was Herman Melville a secret prophet? The answer is no, and we know that thanks to a mathematical principle called Ramsey theory. It's the reason we can find geometric shapes in the night sky. It's why we can know without checking that at least 2 people in London have exactly the same number of hairs on their head. And it explains why patterns can be found in just about any text, even Vanilla Ice lyrics. So what is Ramsey theory? Simply put, it states that given enough elements in a set or structure, some particular interesting pattern among them is guaranteed to emerge. As a simple example, let's look at what's called the party problem, a classic illustration of Ramsey theory. Suppose there are at least 6 people at a party. Amazingly enough, we can say for sure that some group of 3 of them either all know each other or have never met before, without knowing a single thing about them. We can demonstrate that by graphing out all the possibilities. Each point represents a person, and a line indicates that the pair know each other. Every pair only has 2 possibilities. They either know each other or they don't. There are a lot of possibilities, but every single one has the property that we're looking for. 6 is the lowest number of guests where that's guaranteed to be the case, which we can express like this. Ramsey theory gives us a guarantee that such a minimum number exists for certain patterns, but no easy way to find it. In this case, as the total number of guests grows higher, the combinations get out of control. For instance, say you're trying to find out the minimum size of a party where there's a group of 5 people who all know each other or all don't. Despite 5 being a small number, the answer is virtually impossible to discover through an exhaustive search like this. That's because of the sheer volume of possibilities. A party with 48 guests has 2 to the 1,128th power possible configurations, more than the number of atoms in the universe. Even with the help of computers, the best we know is that the answer to this question is somewhere between 43 and 49 guests. What this shows us is that specific patterns with seemingly astronomical odds can emerge from a relatively small set. And with a very large set, the possibilities are almost endless. Any 4 stars where no 3 lie in a straight line will form some quadrilateral shape. Expand that to the thousands of stars we can see in the sky, and it's no surprise that we can find all sorts of familiar shapes, and even creatures if we look for them. So what are the chances of a text concealing a prophecy? Well, when you factor in the number of letters, the variety of possible related words and all their abbreviations and alternate spellings, they're pretty high. You can try it yourself. Just pick a favorite text, arrange the letters in a grid, and see what you can find. The mathematician T.S. Motzkin once remarked that while disorder is more probable in general, complete disorder is impossible. The sheer size of the universe guarantees that some of its random elements will fall into specific arrangements. And because we evolved to notice patterns and pick out signals among the noise, we are often tempted to find intentional meaning where there may not be any. So while we may be awed by hidden messages in everything from books to pieces of toast to the night sky, their real origin is usually our own minds.
That's right, y'all. A little something called Ramsey theory. And so we wanted to keep digging and explore a little deeper into the conspiracy theories and all the conspiracy theories that are going around and what makes them so easy for people to fall into. So we reached out to Dr. Joseph Pierre, an expert psychiatrist who works in the field. Dr. Pierre, how are you? How are you doing today?
I'm good. Thanks for having me on.
Absolutely. I'm excited about this conversation. It's super relevant to what's going on right now here in America. As a psychiatrist, your work focuses heavily on explaining how mistrust, hysteria, and conspiracy theories form. So why is it so important that we understand these topics today in relation to COVID-19?
Yeah, well, for sure. One of my big interests is why people believe what they believe, and especially why they tend to believe in misinformation. So during COVID-19, we've seen a kind of explosion of misinformation. The World Health Organization warned that we would be headed for an infodemic in addition to the pandemic. And indeed, that looks like what has happened. And so one of my areas of interest is conspiracy theories. There's been a lot of conspiracy theories around COVID-19. And one thing I want to make clear is that belief in conspiracy theories is actually really common. Surveys show that about 50% of the population believes in them. And so I think we need to understand them in a kind of normalizing way. And to me, the easiest way to understand belief in conspiracy theories is that it's really based on two components. The first is mistrust, that is mistrust in authoritative sources of information. And the second part is vulnerability to misinformation. So when we don't trust what we're told, we then have a tendency to potentially believe in things that aren't true based on what we see in terms of information that's out there.
So you recently wrote an article about the alternate realities and echo chambers that social media creates. Can you elaborate on how mass media does that and what the consequences might be?
Sure. So, a lot of us these days, certainly myself included, a lot of the news that we get, a lot of the information we get off our cell phones and from social media. And so research has shown over the past couple of years that potentially when we're looking at our cell phones trying to get information, we might get two different kinds of news feeds, depending on our pre-existing preferences and the kind of material that we've clicked on in the past. And so in psychology, there's a phenomenon called confirmation bias, which means that all of us, when we look for information, we tend to grab onto information that reinforces what we already believe, what our own pre-existing intuitions are, and we tend to turn away and reject information that contradicts it. In online spaces, when we're using Google searches or we're looking for information on YouTube, because the algorithms are designed to show us what we want, I call this confirmation steroids. It's a confirmation bias on steroids. It just pumps up the already pre-existing tendency our brains have to search for information that we want to see. And it just does that, a millionfold when we're online.
So what can we do to fix this polarization of perceived reality? Should social media claim responsibility?
That's a good question, a very complicated question. I don't know I have a great answer for it, but I'll say a couple things. I think, we live here in the United States where we value free speech. We value having a free market of ideas. So I think that's one of the great things about this country. I'm not eager to tamper with that model. I do think social media companies, though, are private organizations. So I think they have the right to censor if they want to. They have a right to regulate that information. I think whether or not it makes sense to do that on a bigger scale is debatable. There is some evidence that sometimes if you try to censor information, that has a possible what we call backfire effect of actually just making people dig down deeper. You see that sometimes with conspiracy theory beliefs when they removed the video called Plandemic last spring. Some people were, took that to mean, see, it must be true because, the powers that be took it off the platforms. So I think we have to be careful about that kind of censorship. And I think really the solution to this isn't so much removing information so much as making all of us better consumers of information. I often say that, like, when I was a kid, in my earlier years, you'd be in the grocery store checkout line and you'd see the National Enquirer, the Weekly World News, and you'd know that it was basically BS, and you recognized it for what it was and for its entertainment value. But nowadays, and especially when we're online, good information, objective reporting sits right alongside subjective opinion, sits right alongside misinformation as well as deliberate disinformation. And so most of us really haven't been taught how to sift through that and how to decide what is or is not reliable. And because of that, it's often been said these days that we live in this kind of post-truth world where we can't even agree on what facts are and who to trust. So I think the really long-term solution has to do not so much with controlling what information is out there, but really making us better consumers so that we can recognize, false information and BS, for what it is.
Right. So, I'm not trying to come to you for all of these answers, but I'm going to put another one on your plate right now. What makes people vulnerable to conspiracy theories, and how do you rescue loved ones who've maybe fallen into their grips?
Yeah. So again, the model that I like to discuss so that people understand this easily is that the vulnerability is really related to false information and BS, for what it is.
Right. So, I mean, I'm not trying to come to you for all of these answers, but I'm going to put another one on your plate right now. What makes people vulnerable to conspiracy theories, and how do you rescue loved ones who've maybe fallen into their grips?
Yeah. So again, the model that I like to discuss so that people understand this easily is that the vulnerability is really related to mistrust and exposure to misinformation. So these days, if you look at polls about trust in government, trust in the media, trust in scientific institutions, it's at a very low point. In fact, actually the lowest point that it's been in about half a century at least. And so mistrust is part of it. And then, as we discussed already, just the amount of misinformation that's out there is just a real problem. So in terms of what we can do about family members who have kind of fallen down the proverbial rabbit hole, there's a kind of familiar joke among psychiatrists that goes, how many psychiatrists does it take to change a light bulb? And the answer is only one, but the light bulb has to want to change. So that's a kind of tricky thing, because for the most part, people who believe in conspiracy theories aren't looking for help. They're not looking to modify their beliefs. And I think the mistake that we often make, especially in online spaces, is that we try to kind of argue with people, or we try to debunk, or we try to debate. And I think that's not very helpful. And especially when we're talking about loved ones, that's not really what I see our role as being. I think the more helpful thing is to just maintain connection to people, to give people a reason to sort of come out of the rabbit hole, come back into the real world, put energy in the real life face-to-face relationships that are out there, instead of going down the online rabbit hole and just spending all of their time online. And I think that's the most important thing. So kind of being a North Star for our family members. And then hopefully that's kind of a light, so that when they do get interested in maybe getting out of the hole, they'll sort of see this point and a direction to come to. So I think that's the most important thing.
Mm-hmm. So, we were just talking about the family and how we restore trust, with the family members. How do we do this on a larger scale? Again, I'm just going to set this on your plate. How do we restore trust in our institutions and in one another?
Yeah, so real quickly, I would say that there's a number of different reasons why mistrust is so common these days. One could be that it represents a kind of pathology, an individual pathology, right? Like almost on the spectrum of paranoia. But I think more importantly, there's other reasons. A lot of the mistrust that underlies conspiracy theory belief is actually rooted in racism. So that, for example, you often see the Jewish people being a subject or target of conspiracy theories. There's also very deliberate use of conspiracy theories and cultivating mistrust as a form of political propaganda. So institutions, political institutions, politicians sometimes deliberately make us mistrust other people for their own motivations. And then importantly, some mistrust is actually earned. So when we talk about, for example, medical conspiracy theories, sometimes there's distrust in medical institutions of authority because of conflicts of interest, because of scandals, that sort of thing. And so addressing mistrust really requires a lot of different interventions depending on the cause. And for institutions of authority, what that means is we have to become more trustworthy. We have to gain the public's trust. We have to earn it back if it's been lost. And I think that mostly involves dialoguing with people, letting the public in the door, so to speak, to understand why decisions are made in terms of policies, and being more transparent.
Man, thank you so much for all of this. Really, really insightful. Last question is the question that I ask every guest that comes on this show. Where are you finding your joy today?
Wow, good question. Yeah, I mean, I think as a psychiatrist, what I see in my own patients is that most of us find joy in our interpersonal relationships. So that's certainly true for me. Beyond that, I also really enjoy making things and creating things. And so I have a lot of hobbies that involve creating, and also my writing that I enjoy.
Absolutely. And thank you for that writing. We are also enjoying it out here. Make sure that y'all follow everything that Dr. Pierre is writing right now. Super important, super relevant, and super helpful. So thank you again for joining us, Doctor. And we will have to have you back on to talk more about conspiracy theories. And I want to hear more about what you're creating as an artist.
Okay. Yeah. I'd love to talk about that.
So we'll talk soon.
Okay. Thanks a lot.
Yep. Y'all, let me just tell you, we interviewed Dr. Pierre late last week. Like, it was one of those, like, we went from scheduling the interview to doing the interview real fast, matter of hours. We knew we wanted to talk to him about conspiracy things, and we did, as you saw. But as you saw at the end of the interview, I said, we'll have to have you back on to talk about some of your hobbies. Just an intuitive thing. You know, I don't say that to everybody. In fact, I've never said that to a single guest. This is a show about health, not a show about hobbies. Why would I say that? Unless I'm psychic and having a moment, which I am, and I was. Check this out. After we do this segment, I get this text from Netta. Yeah, because it turns out that Dr. Pierre is a whole ninja, y'all. What? Welcome to our new segment called How Did We Not Talk About This? We will have to have the good doctor on again to talk more about all of that. But for now, that brings us to the end of another episode of Masked Up. I am Andrew Defy. Shout out to our sponsor at Protect Us, and as always, thanks to Netta, Avani, Suchita, Allison, and the rest of the Masked Up Show crew. From all of us to all of you, like Mozzie said, health is wealth and I need my bag. Covered face, no case. Health doesn't come from a pharmacy, y'all. Till next time, stay masked up, and I'm going to send you out with a classic clip from MC Zeps and MC Sully.
All right, so bring that mask over here, right? Hey, yo, check it out. That's a yummy cake, listen to me, I say it fast. If I can't take a bite if I put on my mask, but it's okay, cause you heard me. To go on a journey, you don't want to catch those sicky journeys.
No, I need to wear a mask.
Yes, to keep you safe. You gotta cover your face. Anytime you go outside in the place, you gotta be safe. Was that a burp? That was cool. She's a good girl. She does so good in school.
The one named at home, I can't wear a mask. I can't be sick. I need to not wear a mask only at like school
or stores. That's true. Keep your social distance. Listen to the rhymes just for instance. Thank you very much. Don't forget to wear your mask on your nice little smile. That was Sully and Daddy Freestyle.